Welcome everybody to an exciting day, Bell Let's Talk Day, really promoting wellness, mental health awareness, and an interesting note this year, as was mentioned, looking to instill change and action. And what are the things we can do as a community to help create mentally healthy spaces? And I think that's what we're really going to focus on here today is how can we work to create a workplace that is psychologically healthy and safe? So, as I was so kindly introduced, my name is Jack Veitch, and I do work at the Canadian Mental Health Association, our Haliburton, Kawartha, Pine Ridge branch. I always say the biggest community we serve is Peterborough. It's not in our name. It's super confusing, but we're here. We're excited to be here. And I'll tell you, essentially what I do is I just kind of cruise around and I teach people. Teach about mental health, mental illness. More or less, I teach people how to be well. So in this role, I teach a lot of different certificate courses. So I teach things like Safe Talk, Suicide Awareness for Everyone. I teach assist, applied suicide intervention skills training, mental health first aid, mental health works, the night for the full. I'm a certified psych health and safety in the workplace advisor, and through the Talk Today program, work as the mental health coach for our local Ontario Hockey League team here in town, Peterborough Petes. I can tell you that for many years, again, as mentioned, I worked in a maximum security provincial detention center with inmates, assisting them upon release from the jail, helping them find places to live, family doctor, job or psychiatrist, whatever they identify. It's like a need or a goal. So I did that for a lot of years. Then I decided to get myself this nice cushy desk job where I get free coffee and work in 20 minute spurts. That's what I'm doing today. So I'm glad again I get to be here with all of you and share some of this learning. So hopefully for those in the back, you can see this image to my side. And we talk about creating wellness in a workplace. And I asked the group to say, okay, can we identify the risk for injury for the employee in each of these scenes? In each of these pictures, it's pretty simple on one side, isn't it? We can see that, yeah, we've got someone that's fallen, they've injured their leg. We can see that injury pretty plainly. Sometimes when we talk about mental illness, it can be a lot more difficult to see, can't it? And as a result, it can be a lot more difficult to create safeguard. So how do I work to protect, and a lot of times we use this term protect, or even mitigate risk of illness when I can't see potential injury? Well, I can tell you really confidently and in an excited manner, there are things you can do organizationally that can help to instill wellness throughout an organization, to work as a safeguard, to create a mentally healthy workplace. And I'll tell you, there's reasons that we want to do that. There's stats behind a lot of this. We know that mental health problems continue to be the leading cause of both long and short-term disability in Canada. Yet only 36% of employees would discuss their mental health concern with a manager or a supervisor. So much of what I teach in sort of creating these healthy workspaces and teaching leadership skills and managerial skill is this idea of creating a venue, creating a space where employees, where really anyone in our lives feels like they can tell us what's going on. And it's a really simple sentiment. I can't work to resolve a problem if I don't know what it is. It's when I do know what's going on, I can actually do something to help. And if I essentially have 2/3 of an employee group that is unwilling or uncomfortable in disclosing to me what's happening, it'll be very difficult for me to find ways to work with them to find resolution. So much what I'll be talking about today is trying to create a space, a workplace where employees feel like they can tell you what's happening, because when there's dialogue, there's opportunity for collaborative approach. We also talk about a cost that's attached to a lot of this. So we can tell you again, the total cost from mental health problems in the Canadian economy exceeds $50 billion, that's billion with a B, dollars annually. Nearly $1,400 for every single person living in Canada. And 70% of all disability costs can be attributed to mental illness. So I can tell you all this as well. When I get brought into different organizations, usually there's like an initial meeting before we even get to training or working with teams or building in policy. There's a sit down with a senior leadership team or an HR team, and the question is pretty simple right off the top. They'll say, Jack, why? Why do we need this? Well, what's the idea? What's the goal? And there's actually a pretty simple premise. Again, there's two lenses I look at a lot of this through. There's very much a humanistic lens to a lot of what's going to be discussed today, isn't it? I am certain that generally 99% of people in this room, you want the people that you work with to be well, to be healthy, to thrive, to succeed. There's a business case for a lot of what we're going to talk about today, isn't it? It is 1.5 times more expensive to replace an employee than to train up or support a current. Investing in employee mental health isn't just sort of best practice, but best business. That investment in employee wellness will not just pay dividend to the person, but
but to the entire organization. I will always say a mentally healthy employee will be an effective employee. It'll be very difficult for me to work to the best of my ability if I'm struggling or unwell. And if the things I can do as an organization to help improve employee wellness, it's going to pay dividend or pay benefit to everybody involved. So the biggest piece I'll be talking about here for the next 10-15 minutes is our psychological health and safety in the workplace standard. Now, this was a voluntary standard enacted in January 2013 by the CSA Mental Health Commission's federal government standard. And again, it is a voluntary standard, but what it gives is sort of direction of how an organization can implement psychologically healthy and safe practice across an organization. So I can tell you this is a free document. So if you were to leave this right now, or even on your phone, Google the Psych Health and Safety Act, you'll get a free PDF copy. It's about 84 pages, a fun Friday night read. Maybe not, I can see the smile. You're going to read it on a Friday, but maybe not. Again, it'll give implementation structure and ideas of the things you can do, and I'll also give you all some free websites you can utilize. So no cost attached to help to implement a lot of the recommendations in this standard. And actually back in 2014, so a year after launch, the Mental Health Commission ran a case study, a 3-year case study scenario with different organizations trying to implement a lot of the recommendations within the standard, which we'll key on here today again. And actually one of the participating bodies was locally, not too far from here, was our HKPR District Health Unit. It was actually one of the organizations across Ontario that was involved. And we saw a lot of key findings. I'm not going to read all these again in depth and detail, but essentially what we saw was improved morale, increased investment, increased engagement among staff. Again, a really simple idea, and we'll talk about this again. I feel like a lot of what I teach is actually pretty simplified, but this idea that when you involve employees in decisions, in discussion, when you have them share their ideas of ways they think they can improve the organization, they're much more likely to want to participate in the plan that they help build. Again, so often I'll be brought into an organization, we'll sit down and say, okay, Jack, what should we do? What are the policies we can implement? What are some really good ideas? What if we did a walking group? Or what if we had a new benefits package? What if we did these new things? And I said, okay, well, what if we just asked the employees what they would like? Maybe then that'd be a good starting place for us to decide what we could do as an organization. So the focus of the standard is meant to identify just this. Again, what psychological hazards may exist within an organization? What risk assessment tools could we utilize to measure those risks? Different implementation strategies and practices. Looking to create overall organizational wellness and a sustainability and measurement review, like any change management practice. The idea isn't just, okay, we're going to come in and do something once, stick it in a binder, put it on a shelf, and hope it worked well, but having continued measurement. Let's come back in 6 months, a year, 18 months and review. Is it working? Do we adapt it? Do we scrap it all together? That consistent sort of ongoing review. So from the document, you'll see the sort of implementation structure. And it's sort of driven from these 4 key drivers. And these drivers, again, risk mitigation, cost effectiveness, recruitment and retention, and organizational excellence and sustainability. Risk mitigation. Again, there's this sentiment of, well, what can I do to make sure that my employees never experience a mental illness? How can I protect, again, my keyword, how do I protect somebody from mental illness? And it's a very simple notion. We can't protect people from mental illness because there are so many things that can happen in this world outside of our control. What we can work to do is we can work to mitigate or limit the risk people will become unwell by building in policy and structure, by helping people be well when they're already doing well, by having resources available before we need them, by building plans before we need them. Again, in a Western society, we have very much a post-vention model of care, of support for healthcare donors. This idea of, okay, well, let's wait for the problem to present itself, and then we'll work to fix the problem, which is a very ill-effective way to manage an issue, isn't it? I don't deal with anything else in my life in that manner. I think about my vehicle. I don't deal with my vehicle really in that way. Imagine it like this. If I waited until one of the tires on my car exploded before I decided to change the tire, that'd be a very cool way for me to manage my vehicle. So I don't do that. We change our tires with the seasons, we check them regularly, we tune up our vehicle. We have that sort of preventative measure. Why are we not doing the same things with our mental health, with our organizational health? Why not build policy and plan before we ever need it, so we can activate it when we need it, instead of trying to design it when we need it? Cost effectiveness, again, as mentioned, employee engagement. A mentally healthy employee is an effective employee. And there's a term I'm sure you'll hear today called presenteeism. Maybe you've heard it before. Yeah, maybe I'm able to have my employee come on site, but because of mental health concern, because of mental illness, they're not able to work to their full or best capacity. If I can work to ensure a mentally healthy employee, I'm going to reduce presenteeism. I'm going to reduce absenteeism. I'm going to reduce lost time and turnover. Again, if I can have my employees working well, I'm going to see cost benefit and cost effectiveness. Overall recruitment and retention. We are in a labor market right now. That can be difficult to hire, to find employees. Again, how do we make ourselves the employer of choice? And I'm going to say the COVID word right now, so stay with me for it. Think about the things that COVID sort of forced upon many organizations. If I were to stand on this stage 7, 8 years ago and suggest that, hey, you know what? We could probably all be doing a lot of our work remotely from home and encourage virtual work. I would be heckled off this stage. But again, COVID forced the hand of a lot, and what we found is that when employees, again, have that opportunity to work compressed weeks, to work from home, to shift their time, to shift schedules, well, gosh, we still hit a lot of our targets, but that ever-elusive organizational culture, that ever-elusive workplace wellness started to improve, the morale improved. We're seeing retention rates that are better and stronger. So what can we do again to think progressively? And that's why I encourage people, I challenge people here today. If we keep thinking about, okay, well, here's what's worked before, let's just try to do the same thing again, maybe we'll probably get the same results. What if we had organizations that were thinking in sort of the mindset of now, 15 years ago? Maybe they would be that employer of choice. What can you do to make your organization an employer of choice? Again, that organizational excellence and sustainability, encouraging employee feedback. I said it before, the best way to find out what's going to be helpful for your organization is to ask the people involved in your organization. Asking people, building plans with people. I say this through every single course that I teach. You will always be significantly more successful working with somebody than you will be working at somebody. Involving a person, building a plan, makes it that much more likely they're going to want to do the things in the plan. So how can I engage and involve my employees? And again, the standard has its sort of root foundation in its 13 what they call psychosocial factors. And we won't go through all of these in detail because, again, there's people much smarter than me coming to this stage to share their notions and ideas as well. I don't want to waste their time. But I do want to pick on some of these sort of factors and expand them a little bit more. So we talk about reward and recognition. I'm going to blow your minds right now. We have research that shows if you pay employees more, morale improves. Again, write it down. Wow. Now again, there's a limit to this again because I'm sure there's many organizations in here that would love to pay their employees more, but we're on a finite budget. There's limited income. There's resources are stretched so far already. What I want to emphasize is reward and recognition does not always have to be in more pay. Again, frankly, if it is, you'll see benefit. But what I can tell you is there are other ways to recognize and reward an employee that will improve employee wellness and improve morale. There's an organization that I work with, and they run a program, and they call it sort of like a postcard program. And it's a very simple program. Essentially what can happen is there's these pre-printed hard copy postcards. And they're just the side of a typical postcard, they're like a congratulatory letter. So anybody in the organization can send one of these postcards to any other employee for a job well done, a recognized support. Thank you for your assistance. Thank you, Joel, for adding the really cool stuff to my bio, because that makes me feel great now. I'm going to put that on mine moving forward. I'm going to send Joel a postcard. Now, what's the cost to the organization in that sort of interaction, in that program? Well, we're printing those postcards at cost, at bulk. Shoot, maybe that's 15 cents a postcard, 30 cents a postcard. Let's go real risky. Let's say 45 cents a postcard. And we're sending those out a couple times a year. Let's say maybe a couple $100 a year. And then every month, every single person that gets a postcard, their name goes in a draw, they can get a $10 gift card. So the grand total cost of my reward and recognition program, we're going to estimate around $400 to $500. Now you might be thinking, okay, $400 to $500 investments in employees, I can do that, but does it really make a difference? I will tell you this. Walk through that organization, through their office spaces, through their desks, and count how many employees have their postcards displayed prominently, so that every single person can see, hey, here's what I've done. Here's how I was recognized. This simple, cost-effective, yet effective way to recognize and reward employees. We also talk about psychological demand, taking the time to measure. Do my employees have the resources, the tools, the support to meet the requests of that job description? So again, a lot of times it's just sitting down and not just connecting with the employees, but reviewing that job description. What are the core expectations of the role, and am I able to provide the resources to have that employee meet those core expectations? And if not, how can we sit and work together to hit these expectations? Can we reevaluate what that role may need to include? Can we reevaluate how we disseminate the work across this organization, measuring to make sure the employees have the tools, the resources available to meet those tasks? That's psychological protection. And again, I keep saying that word protect, and I know I have a psychotherapist in the room who's going to can't protect, but again, we're going to mitigate. We're going to do our best to mitigate risk, providing opportunities for feedback, for engagement, trying to minimize threats. We can't eliminate threats. It's the same thing we teach when we talk about suicide intervention training. Unfortunately, there's nothing I can teach that will eliminate suicide from our community. However, we can mitigate risk by increasing education, awareness, and resource to people when they need it. And again, implementation essentially has four distinct sort of steps. Leverage the existing resources that you have, engage leadership from a labor and management perspective, embed across the organization, and then close out accountability. Leverage the existing resources. Really often, I'll come into an organization, we'll sit down, we'll start that sort of meeting, and there's this real fear of like, oh gosh, has anyone here ever gone through accreditation? Is there an organization or an accreditation process? People have done something like that, I'm sure. And there's that fear of like, oh boy, we're being judged, we're being watched, and we're going to be told all these things we're doing wrong. I will tell you, so often these meetings are an opportunity to almost quantify. Here's all the things you're doing well. Here's all the things you're doing right. But let's sit down and actually sort of calculate and consider and compile all the things we're doing. And let's try to find a way to measure their effectiveness. And now that we can see they're effective, maybe we can turn that $400 program into a $4,000 benefit program. Who knows what resources we have that we don't know, till we actually leverage and see what we've got. Use the resources available to us. We have, maybe we're fortunate enough to have an HR team, an EAP provider, amazing community resources and partners we can work with. Let's see who can come to the table. Let's see what we're already doing. Let's review what we've got. Let's engage leadership. Again, you will all know this. And if you run your own company, I'm sure you're well aware. With any change management process, it's going to be a trickle-down approach. If we do not have the investment from the very top, it will be very difficult for any policy to succeed. If I'm trying to implement change from the middle of an organization, that can be exceptionally difficult. Because people are going to reflect back and see, and we're talking about this in closing the accountability loop, what is the top of the organization doing, quote unquote? What are the leadership teams doing? Are they following these practices? Are they engaging in these policies? Are they doing the things they're telling us to be doing? Embedding across the organization, getting that buy-in, and closing the loop. Making sure, again, that there is investment. And this is what I'll say, if there's senior leaders or business owners in the room, I will tell you, people are watching. They are watching you. They will notice when you don't take your lunch. They will notice when you don't take your break. They will notice when you're there early and you're there late. And I recognize there's many people here that work real hard and care passionately about the work they do, and I'm sure that that is an investment they're making in the organization. But again, if we're trying to establish that, hey, you know what, it's important that you take your lunch. It's important that you take a break and reset and recharge and refuel. Again, it is very difficult to pour from an empty cup. If you're drained, depleted, or without charge, if I go to plug my big screen here into a power bar that has no hydro, it'll be very difficult for me to do this presentation. But if we recharge, if we reset, if we prepare, we're able to actually deliver. Again, all these messages you're sending to your staff, to your employees, needs to be modeled, demonstrated. Close that accountability loop. Be the change that you want to see within your organization. So again, in implementation, what external sources of data do you have to collect? Again, if you're fortunate enough to have an EFAP and EAP provider, They'll be able to collect a ton of data for you. Again, not who is accessing your program, but how many, and where, and how often. Are we promoting our programs well? Are we sharing this information in a way that makes sense? Are we realizing that our sort of engagement rate is maybe below 5 to 4%? We're in our 2% engagement range, which is maybe not what we want. Maybe we're spending money in ways that isn't as effective as it could be. But let's start to gather data. Do we have internal ways of collecting data? Do we have a sort of return to work policy? Do we have an HR team or someone in the organization that's measuring absent time and sick time and lost time? Are we seeing patterns across programs or teams or organizations? Are we recognizing that maybe one particular program has had a lot of turnover and lost time? Why are we seeing that? What could we change? How could we support that team differently? Gathering this data, involving all stakeholders. Again, this doesn't have to be confrontational. In fact, if you work in a unionized environment, this is a fantastic way to build rapport and relationship, to bring those union stewards, to bring those union leaders, to bring everybody to the table, to help involve them in the plan, and let people know we want to do this together. We want to work collaboratively. We want to hear from you what will be successful. And again, we can recognize there are limits, like any collective bargaining, there's limits in what we can give and take, but we want to work with you to have you involved. Again, even those baseline surveys of communication, hearing from staff, establishing baselines. So there's actually a free tool, there's 2 free tools actually, I'm going to give to you, which is exciting for everybody, I'm sure. The first tool is a website called guardingmindsatwork.ca. It's a free website which uses the structure of the Psych Health and Safety in the Workplace Standard and helps you to collect and compile information using surveys, using data measurement tools, and will help to show you, are there areas in your organization that are really strong? Are there areas where you have opportunity for growth, to see new things and new change? So guardingmindsatwork.ca, a free resource I encourage you to check out. The other is a tool called Minds Matter. I have a colleague that works for Civic Action, does some fantastic stuff. A very similar free tool, you can Google it as well, to help to implement a lot of these practices. And really, again, the Psych Health and Safety in the Workplace Standard is a free document. It doesn't cost anything to download, to access. You can use it to support employee wellness. All right. So again, our free tools, and I don't want to go too long. I feel like I'm being long-winded right now. But I do want to end with different resources. So again, many organizations are smaller or have limited resources. So what community partners may exist? 4 community partners in the room to access for themselves or for their employees. Well, again, as of November 30, we launched across Canada was launched a national suicide crisis helpline for people experiencing thoughts of suicide or emotional distress. I can tell you quite proudly that the local CMHA I'm here with today, is a service provider in the 988 model. We're one of many across the country. So you may have heard our historic 4-county crisis model. People may know the 4-county crisis number. We've rebranded and sort of renamed and worked under the umbrella of 988. And this is a really exciting advancement for the organization, really for the community. Again, by moving to this model, we expand access to care. So anybody in Canada can dial 988 and get connected with help 24/7, 365 for toll-free. And the benefit, if you call from a local area code, it is very likely you will be connected directly to our resources here in Peterborough. Now, the extended benefit of this, if you've ever accessed the historic resource before the 4-county crisis program before, you may have heard tell or heard stories, even experienced, unfortunately, maybe get in a voicemail system. So you call the crisis line, you're calling for help, and we get a voicemail. And again, the reality of the service was, again, finite resource. If I've got 3 employees working that crisis line, and all 3 are on an active call, best practice tells us they can't leave that call to take the next before those issues are resolved. Which meant, again, that 4th, 5th call, maybe there's no one there to take it. Under this model, this network of care, if all those lines in Peterborough are tied up, it'll relay to the next available operator and service provider, to the next, We're all working together on a central database of information. So no matter where you work, where you're from, where you're calling from, you know what's available in that community, making it literally near impossible to get a voicemail. It works very similar to a 911 model. This is something we've seen run in the US now for 24, 25 years, very successfully. It's super exciting to see it here in Canada. Again, 25 years too late, but we're here. We did it. 988, toll-free, share with your employees, share with your staff. I've been working with CMHA at Toronto with their communications team. We'll be having more promotional information for business owners, for staff, for community partners. They can share resources, wallet cards, brochures. in the near future, the coming weeks. I'm told the coming weeks or months. I'm pushing for weeks. In the coming weeks, you will see some more resources as well. Again, this does not mean there aren't still a variety of other resources. Again, our national suicide prevention helpline is an American number. It'll take Canadian call. Our Kids Help Phone has both a phone number, text feature, and chat at kidshelpphone.ca. All free, all accessible, all 24/7. I'll also encourage people to engage in sort of education and awareness. One of the recommendations in the Psych Health and Safety Standard is that employees take mental health first aid training. And again, it's something I will advocate for, I will recommend, but again, I recognize that in many organizations, finite resource, finite time. Allocating 25 staff for 2 days, it's maybe not cost effective, it's maybe just not tangible, it's not feasible. So again, there are alternatives that we offer through CMHA, education and training specific to leadership. How do I recognize an employee might be experiencing mental distress? How do I recognize an employee might be struggling? How do I connect with that employee? How do I guide them towards care? How do I build an accommodation plan? How do I support that employee wellness while balancing performance management, which is one of the big ones that comes in quite a bit. These simple courses you can access in a couple hours, in a couple days. We run all across the region. Encourage you to reach out. Again, suicide intervention training, as I've promoted, is always a benefit. And again, our community agencies, CMHA, the CCRC, the New Canadian Center, there are so many partners. And if you don't know what's available to you, Google.com is a fantastic resource to check out what's available. You know, people say, well, Jack, I'm in a new community. I know what's available. What about this? How about this? Imagine this scenario. What if I had access to a literal infinite amount of information? And what if I had access to said information 24 hours a day? Wouldn't that be amazing? Show of hands, who here has a smartphone? Mental Health Services, Peterborough. And you're going to find some. I don't have to know everything or know every resource in my community, but I can look to work with somebody to find what's available. Don't feel like I have all the answers, because a lot of times they're already in my pocket. All right, so with that, I think I'm right at my time mark, which would be a real benefit. Maybe I'm over. If I am, I apologize. But anyway, awesome. I'll introduce Joel back. Thank you so much for your time.